Hey, thanks for joining me. I'm here with Dr. Chris Owen in Australia, and I am particularly fond of Dr. Owen. One, I got to meet him in person at the last patient mastery training in Melbourne, and I didn't know him at the time, but we introduced ourselves before the training started, and I was very, very impressed to find out that he's been in practice over 30 years, 8 different successful practices in multiple different countries. Now, to be in practice over 30 years, one's accomplishment. To have done it successfully is another accomplishment. To have multiple practices is another accomplishment. And to do it in different countries and cultures is another accomplishment. So I look at Dr. Owen as someone with tremendous, not just skill, but wisdom, integrity, someone who exemplifies this profession extremely well. He's obviously in 30 years, he's experienced a lot, he's seen things that work, that don't work. And what I admire just as much about him, that 30 plus years into practice, he's still learning, he's still growing. That's why he came to a patient mastery seminar, and I'm going to have him share the differences, or some of the differences that he's noticed in practice. Um, I don't know, 6 9 months, 6 months ago since that meeting. So I'm going to turn it to you, Chris. What would you say is the most important difference you've seen that you know other chiropractors can relate to?
Oh, hi, Josh. Thanks for those wonderful words, and my feelings towards you are obviously a mirror. Um, I'd just like to firstly say that with Josh, he is the real deal, and the technology that he teaches you, he applies himself. I've been to many practice management courses and seminars, and I've met the people who run it, and I know they really don't remember who I am or what I told them, but within one meeting of Josh, he genuinely remembers everything about me, everything I say, everything that I want, and really works towards fulfilling, those wants and needs. And I guess the biggest thing that it's helped me with after being out of the Australian environment and coming back after 12 years, it's really helped me with patient retention. Because I find in chiropractic there's this really grey area between initial relief care and what, for lack of a better word, maintenance care. It's that grey area where we lose so many patients because they just kind of don't understand why they're hanging around. They're feeling all right after 3 or 4 weeks, and they're kind of been coming in fairly regularly, and they're a little bit done. And I've found Dr. Josh's process is just absolutely amazing for getting people to stick with 3 months of care. And I find that once they do 3 months, a greater percentage of people, they've got it. You don't have to teach them the big idea. They own it. They feel it. They live it. Their wife sees it. Their husband sees it. Their kids see it. Their dog sees it. You don't need to worry about this, preaching an idiom that might be foreign to them. Just preach what's most important to them, which is them. I remember in my first year of practice, a chiropractic mentor that I had, he said, the sweetest words that someone will hear are their own words. And Dr. Joss's process, especially his 6-question new patient process, it really teaches you to listen. It really teaches you to vocalize back to the patient step by step exactly where they are and where they want to go to and how they're going to get there. And then following that, once you get to your recommendation visit, which is a structured process as well, you're basically just feeding them back their own words, and they do not like anything more than the sound of their own words. It is such a powerful process. It works, and it's really taken a lot of stress off me and practicing again in a new environment. It's really helped with my patient retention. It's really helped with collections. I've had mornings where we've collected $6,000 before 9 a.m. in the morning, which is kind of a nice feeling. And it's helped me with my personal life. Josh's process is as we all know, as seasoned chiropractors, how you are and where you're at in between your own head is where your practice will be. And Dr. Josh understands this better than anyone that I've met, and he really helps you with with processes beyond just patient management, with processes with how to run your life, with meditation, and it's helped not just me, but it's helped my wife. We use his technology every morning, and I'm just kind of life is easier than what it was 6 months ago. So thank you, Dr. Josh.
That's beautiful. Thank you, Chris. I'm going to just touch on a couple things you mentioned. When you were mentioning the recommendations conversation, like you're just giving it back to them. And you really are, because I know I used to have such a pit in my stomach of like, I've got to convince someone or I've got to educate someone. And to make it more specific for people watching this, it's literally like you're giving them exactly what they want through your process. You're not trying to change them, change their mentality, get them to agree with you. You're giving them exactly what they want. And that's what makes what usually in chiropractic is such a tough conversation or there's a lot of anxiety around it. It can actually make it easier because you're like, you could do it with a smile, right?
Yeah. When I talk to my CAs in our huddle, one of the things I got into their heads when we started using this technology was that there's no wrong answer. And I feel this is a really powerful statement because I think as chiropractors, we lose a lot of people because we have an expectation of how someone's going to react. And if they don't react, well, then, my way or the highway. And, with Josh's technology, a percentage of people, they may not be interested in doing a 3-month, signing up for a structured plan. But, I've been using this technology for 6 months, and a lot of those people who didn't sign up, they're still with me after 6 months, just by the pre-framing of where we're about to go, and there's no wrong answer. So that's taken a lot of pressure off me and my front desk staff as well. And in that the girls can honestly look in the patient's eye and go, well, yeah, this is best for you, but it's always the patient's choice which route they pick. And the funny thing is, whatever route they pick, they end up picking the right route. They hang around, which is awesome for them.
I'm glad you just mentioned that because a couple times you mentioned 3 months, and I use that a lot as an example. But a lot of chiropractors will think, well, everyone shouldn't get the exact same care plan, and I don't like the whole my way or highway. And you cleared that up where 3 months is one of the options you provide, and it's not the only option. And if someone, like, there's multiple ways to go forward, and there's no right or wrong, and you're being the best doctor with their interests in mind, as long as it's good for your practice, because it's got to be balanced. And so I'm glad you mentioned that it's not a my way or the highway, and it's not a cookie cutter, everyone gets the exact same thing no matter what. And in the beginning, you very accurately mentioned there's this gray area in chiropractic of few visits, relief, get out of pain, to maintenance or stay for life. And a lot of chiropractors are one way or the other. And to be in that sweet spot in the middle of creating that relationship and then the person coming on for their reasons, not because they learned what a subluxation is a really beautiful feeling to be able to create that relationship with patients. So thank you for mentioning that.
Yep.
Anything else that you think, again, the reason we're doing this is I find in my travels and communication with chiropractors that more than any other profession, it's so often stuck in, it's always been this way, this is how it's done, this is how it needs to be done, and if it's not going well, I'd have to do it harder and stronger, and you know what I mean. And really opening up chiropractors' eyes to there's other ways.
One of the things that I find coming back to Australia, which is really strange, in that where I was practicing before, chiropractors were under such a high regard. We were just another doctor, and it was just a unique experience. And then coming back to Australia, it's not like that. And one of the things that's used against chiropractic is, it's an unscientific dogma. It's like a religious belief. Well, yeah, we love what we do. So I guess to the outside world, we feel like people that are religiously motivated because we're just so passionate about what we do. But, we're not the patient, and the patient is someone who has a need, and it's our job to fulfill that need. And chiropractic I practice in areas where many of my patients didn't speak English, and chiropractic is beyond words. You don't need to educate someone about a subluxation. Just listen to their needs, fulfill their needs. And one of the most powerful things with Josh's 6 questions is that you'll be shocked when you ask people about, different timelines of recovery. You'll be shocked how they give the right answer. This is one of the most amazing things that I've found in that, let's face it, a lot of our patients, if you don't do any education, You know, they'll come in and they'll come in for 2 or 3 weeks and they'll feel a bit better, and then they'll come back when they feel like they need to. But that same person, if you ask them the right questions from the very start, they will vocalize to you that, well, yeah, this will probably take about 3 to 6 months or maybe 2 years. That is awesome.
Because they're telling you. You're not telling
them. I didn't say that.
Yeah.
You said that.
Yeah.
And it's amazing how many times their expectation of recovery is worse than what you might think. And it's so great to go into someone, you know, 2 days later and go, well, Josh, you know, like you said, you felt it might take 2 years. I think we can do much better than that, Josh. I think that within about 3 months, we can probably see awesome changes of 70, 80%. And this same person may have been the guy who came in for a couple of times a week for 3 weeks, and he was gone for 2 years. So yeah, awesomely powerful. It works. I recommend it to anybody. I've done a lot of things, and I've got jaded with practice management. I just felt it was just didn't make me feel good when I said it. And as Dr. Josh says, you know, it's got to be something that you could say to your brother or your mother. And this stuff, I'm totally comfortable with it, and it helps me have a really good day.
Awesome. Dr. Chris, Owen, thank you so much for your contribution to the profession, all the patients you've seen. To doctors, when we get on those group calls, you're contributing to them. So thank you for that. Thank you for all you do and who you are. You're awesome.
Yeah, thank you so much, Josh, and all the best with the book. And I look forward to seeing you on Ellen within the next 8 months.
Thank you.
Okay. Have a good day.
All right, I'll cut it. Thank you so much, Chris. I really,
Okay.
really appreciate it. Have a wonderful morning.